Okay, hey everyone, and welcome to another International Achievers webinar. My name is Aditi, and I'm the founder of the International Achievers. For those joining us the first time, the International Achievers is a student led initiative focused on making career exploration feel more accessible through conversations with professionals from different fields. One thing I've seen as a student is that we often hear about careers in theory, but not always what they actually look like in real life and what the path feels like, the challenges, the uncertainty, and the lessons people learn along the way. That is exactly why I host conversations like these. Today, we'll be diving into careers in medicine, biology, healthcare, and decision making with someone who brings both expertise and experience. It is my pleasure to introduce Dr. Prashanth Muthukrishnan, who is a physician specializing in pulmonary medicine and critical care medicine. Throughout his medical journey and career, he has worked closely with patients facing serious and complex health conditions. Today, he'll be sharing insights into his own journey into medicine, what working in healthcare actually looks like, lessons he learned along the way, and advice for students who are exploring medicine, biology, healthcare research, and related paths. Thank you so much for being here with us today. We're really excited to learn from you. To start us off, we'd love to hear about your journey.
Absolutely. Thank you so much, Aditi, for bringing me on here. Hope you're all able to hear me well. And it's such a pleasure to be amongst students, the youth of America. I am about early in my, my first part of my career. I'm in my 8th year as a physician since graduating from fellowship. And so I'll give you a brief timeline of my journey so far. So 2005, I started medical school in India after finishing 12th grade. In India, I don't have to go through undergrad. After 11th and 12th, we get to choose directly to go into our medical field versus engineering field. Back in India, there used to be still a lot of students going into BSc, which is Bachelor of Science those days. That used to be similar to what people do here in America, where they would do a BSc and then try to figure out whether they want to become doctors or engineers. But for the past at least 20 years, after 12th, people are directly able to go into bachelors of engineering or into arts, commerce, and medical careers. So in a way, there is both pros and cons for not spending that extra 2 to 3 years of the so-called undergrad that people do here, because you're already tying yourself up towards one path or the other, which is either into medicine, pure clinical medicine, as against engineering or allied fields. The cons is that you are hoping that as you begin your first year of anatomy, physiology, biochemistry, and so on, these are the subjects in the first year of medical school, you just hope that you are actually somebody who's meant to be a physician. So that's one of the cons. However, the pros is that you are potentially focusing earlier in your career towards what you actually want to be. So that actually gives you a lot of responsibility to try to spend more time ahead of time during your 11th, 12th grade and early years of college to see what it feels to be a doctor, or just trying to get exposure to various avenues, like for example volunteering in local hospitals as just an assistant to a nurse, or just joining the volunteer department at the local hospitals, or medical camps that are run by churches in the area, shadowing doctors in the neighborhood, looking for opportunities where you can be in the field, like joining a paramedic company. There is like EMS teams that you can join, and you can do summer internship jobs there by offering yourself, saying, hey, I'm free for the next one full week. Can I join you guys, be in the field with these paramedics, go along with them as they attend to various patients who are calling 911. and so on, or even the local fire station, because the fire station also responds to a lot of these 911s. So just being in the thick and thin of actually what it means to be in the healthcare field earlier in your life may give you some exposure, and this may help you, figure out whether this is something you want to do or not. People who are very extrovert in terms of speaking skills, or they like to talk to people, those are again people who may flourish well in the field of internal medicine or in the medicine part of the healthcare, because it involves a lot of talking back and forth between patients, families, and if you are not somebody who is into communication skills in terms of talking to people, then those are certain signs that you should look into ahead of time. Maybe I need to look at fields that deal with more of focusing on research based things, say medical research, more into lab and so on. Of course, even in the research field, you need to talk to people to express the findings of your research protocols. You need to have communication skills to make sure that they accept your dissertation. So there is no field that is going to say you don't need to communicate at all, but definitely the medical field involves a lot of communication. So those are things that you can already get a sense if you put yourself out there in the field. So after joining medical school in 2005, anatomy, physiology, I was able to understand that there are certain aspects of medicine that I felt more comfortable with. For example, physiology, the reasoning behind disease it felt more appropriate for me. That was my strong point, as against anatomy, surgical skills, and so on. So your own conscious gives you a sense of what you're comfortable with. Similarly, as I went into the third year, that's when I got exposed to the USMLE, medical licensing examination system, which you will also guys be taking during your medical school third or fourth year. So the only difference between you guys here in America is that you will take a SAT exam just before your undergrad, and then after undergrad, towards the end of your undergrad, you will take your MCAT exam to be able to apply for medical school. And then once you're done with your medical school, then you will go through USMLE during the third and fourth year, which will help you apply for residency programs across the country. And then after that, you go on to either becoming a doctor, like internist or hospitalist or dermatologist, or whatever field you want to be in. And then if you want to super specialize in a certain field, you can always become say for example, after internal medicine, you can go into pulmonology, critical care medicine, cardiology, and so on. Similarly, if you after medical school, you can go into surgical residencies, and after surgery residency, you can again either become a general surgeon, or you can specialize further to become specific types of surgeon, like neurosurgeon, cardiothoracic surgeon, urology, and so on. So again, the decision making opportunities are always going to keep coming again and again. You will always have those periods where you have to figure out, do I do this or that? Which field do I go into? It's never going to end. So therefore, you will have to start cultivating the habit of putting yourself out there ahead of time. That way you give yourself a lot of time to be amongst the people that you want to be. For example, in internal medicine residency, I had a confusion. Do I want to be an endocrinologist or an internist, like a general primary care doctor? And there are so many factors that influence your thought process. For example, the money behind each specialty, the type of patients that you will see, whether you are even interested in that particular type of cases. So again, what these residencies give you is they give you an opportunity to rotate in different subspecialty clinics. For example, they'll send you to a gastroenterology clinic and gastroenterology consult service inside the hospital, and you work with the doctor, and sometimes you'll be like, oh, I like GI, oh, I want to be a GI, but next month you go to nephrology rotation, I want to be a nephrologist. So it's never going to end. But certain times you'll feel, oh man, I definitely don't want to be a cancer doctor. It's very hard. I can't go through those emotions. Well, critical care also goes through a lot of emotions, because we see patients who are in their end of life phase, and we have to be able to let go of human lives. And I have some very, very tough conversations with families talking about death all the time, and it becomes so numb some of these times that I talk to them. But those are things that you will only be better off if you get some sense of what your life is going to be like. Not that I knew ahead of time personally. I never knew I had to have these life and death conversations when I was doing medical school first and second years, not even in third year, probably the fourth year when I did internal medicine. See, unfortunately, the actual subjects that we do in clinical life as a doctor come only at the very end of medical school. So the first year, the second year, it's full of theoretical sciences and understanding how the mechanics of the body works, what are the chemistry equations of various enzymes that happen in the body, and so on. So the bottom line of that first phase that I want to talk about is somehow get yourself out there early in your 11th grade, 10th, 12th grade, summer, vacation time, and even as an undergrad, talk to people. Like, say, if you go to a sports league, say you play soccer during the weekend, talk to the other seniors there. What are they doing? If you go to a local, say, Sai center or a temple, like a Balavihar, whatever, some kind of community that you are in, don't be shy to talk to people. Ask them, hey, who are you? What do you do? How's your work life? Tell me a little bit more about what you do. I would love to hear. And then say, hey, can I join you one of these days? I would love to watch you at your own workplace. Like that. There are so many centers and philanthropic organizations that also go to different countries, or Mexico, nearby states, or even in San Francisco downtown area, some of these homeless shelters, or even nursing homes where you can actually go and participate as the medical camps, and that will also give you a sense. Okay, so after medical school, I did residency. So 2010 and 11, I started figuring out, okay, do I want to continue in India? Do I want to attempt USMLE? Because one of the things was my sister happened to be in the US, and so that gave me one reason to consider the US, for future studies. And in India, there is very, very rigorous exams that get you past medical school into postgraduate studies. So I just looked at, compared the Indian system and a US system, and I thought, why not try the curriculum of USMLE? And I really liked the curriculum of the question patterns. In India, it was a lot of facts and figures that I had to remember. I am actually good at remembering facts, but when I looked at the questions on the USMLE exam, I really loved it, because they focused on what it means to understand the physics and the chemistry behind the human biology, and trying to address these questions. So I really loved that. So that's what that was one of the things that made me really interested in trying to see whether I can consider residency in the US and practicing in the US. However, after I finished through the USMLE step 1, I got good scores, and that was not the end. It was very hard to get interviews in the US. So I came actually into the US, did elective clerkship rotation. So you will also be doing that. basically as part of your third and fourth year clinical years in medical school in the US, you will be actually asked to go to different hospitals and try to do clinical rotations as clerkships. So I got a chance to do that all the way from India, and that's how I got letters and all that. So some of you uh, may be questioning, hey, is there a way that I can go to India to do medical school despite having been doing high school and undergrad and all that here? There are some people who do that. Um, medical school in India is cheaper as long as you can compete with, the compete with the locals, because they have a reservation system and so on. So it is not easy, and there are certain types of medical schools that are only going to take NRIs. You cannot, I doubt that you can get into the regular government medical colleges in at least in Tamil Nadu. So SRM is one of the good colleges that probably has a lot of NRIs. Kasturba Medical College, KMC Manipal, that I know that have AIMS possibly has some NRIs, and there's a lot more. So I don't know personally the entire list of colleges, but that is also one possibility. But I would probably recommend staying local in the US and potentially also considering Caribbean medical schools, because we have so many colleagues who go to medical school in the Caribbean islands, and because they do get clinical third year and fourth year rotations all through in the US. You don't have to be only in the Caribbean all through your medical school. So that way you get actually exposed to a lot of US hospitals in clinical years. So I came for interviews. I got into UPMC, University of Pittsburgh Medical Center, into one of the community hospitals. So there are university sites for residencies, and then there are also community sites. For example, main campus versus one of the satellite campuses. I would say, for example, Palo Alto, Stanford is the main campus, whereas if you want to look at one of the other Stanford community hospitals, you can go to some of your other suburbs and you can do residencies there. Like that, I did residency for internal medicine for 3 years, followed by I went into fellowship for pulmonary critical care, and I did that in Cleveland, Case Western Metro Health Hospital. And then I worked for my first job in the Bronx in New York City for 2 years, and then I came over to West Virginia to do some rural service for about 5 years as pulmonary critical care physician. And then currently I'm in Georgia doing my 8th year as an attending doctor. They call doctors as attending physicians.
Thank you so much for sharing your journey. We do have a couple of questions from students in the chat right now, and just I want to let everyone know that if you do have any questions on the way, you can drop it in the chat, and I'll definitely be answering those. A student has asked, will it still boost your knowledge if you try to help in a general medicinal camp, or should we try and find a camp based on the medical field you prefer to go into?
So something is better than nothing. Even when it comes to exposure to the medical field, I would totally go into general medical camps. It does not have to be a specific subject. And if you happen to get something in this specific area of interest, perfect. But you will not know how the other subjects are unless you actually get exposed to it. So I would rather have both the opportunities, get a general medical camp, and then once you get into that medical camp, you might meet other doctors, and maybe one of them can connect you with the other doctor who is a specialist in that field, and that way you get it's not only about what you want, it's also about what you don't want that you need to know.
Thank you for answering that. I also know that you have a lot of experience in Ayurveda as well, so I would like to know about your journey in that.
Sure. So these days, lifestyle medicine is becoming very popular. You may have already seen across different internet avenues, and also in California. California is probably one of the good states where lifestyle medicine is booming. Basically, that means using lifestyle as medicine to create health, because the most of the diseases, but for genetic congenital diseases, are acquired during our life. We call them as metabolic diseases and lifestyle diseases, and the most common diseases are hypertension, which is high blood pressure, diabetes or insulin resistance, and along with that all the downstream effects of these two, hypertension and diabetes, leading to other downstream effects like congestive heart failure and so on. The immune system is very much closely linked to something called metabolism. When the metabolic health of the body is good, obviously automatically the immune system is very strong. The immune system can become very exaggerated or hyperfunctional, or it can be reduced. Both ways are a big problem. So some of the diseases we have, like say asthma, metabolic syndrome has a lot to do with the underlying reason behind how you develop slowly over years. You develop an inflammatory response to various things that you get exposed to, including the food you eat or the inhaled triggers, like say you walk on the road and it's a pretty dusty road, or you walk in the pollen season outside and you are starting to sneeze and start having a lot of bronchospasm and so on. So these are all many a times lifestyle diseases. There is always a genetic predisposition to become somebody who develops disease over time. So there are two switches. One is the gene, and then the number two is the environmental influence, what you do during your own life to your body. So we cannot fix the gene as of now in most of these lifestyle diseases. However, the environmental influence, or the so-called epigenetic, which means something more than the gene, that is what you can do. And the only thing that we know that we can do about is figure out what is that we are doing in our life, which is our lifestyle, that is contributing to the development of inflammation or imbalance. And one of the oldest forms of lifestyle medicine is Ayurveda. There are so many. See, Western medicine is very, very new. Western medicine started much later than Ayurveda, Arabic medicine, Unani, traditional Chinese medicine, because those are systems of knowledge that have been there for thousands of years. And the current method of proving certain things has become the standard of care right now, because that's all we know. Whereas if you go back, if you lived about say 500 to 1000 years back, the method of evidence was different. Right now, randomized controlled trials is the way that we have, as a population, we have agreed that hey, we need to compare A versus B, whether something, a drug or a pill or a lifestyle modification. For example, I'll give you a simple example. Weight loss has a positive association with a reduction of breast cancer risk as against no weight loss, right? So they compare a group of patients with breast cancer risk, and they try to figure out, okay, these patients had achieved weight loss and these did not achieve any weight loss. So those are certain types of research that we do here. But those days it was mostly one arm, single arm studies, which is practice based evidence, right? The Ayurvedic practitioner or the traditional medicine practitioner, he or she cannot compare two different populations saying, oh, okay, I'm going to give you this medicine, I'm not going to give you this medicine, and we'll see how you do. Those days it was not practical, because when somebody is suffering, we have to take care of them. So practice based medicine is where you as a population learn about some practices or lifestyle modifications just by actually doing it in real life. And so that is called as practice-based evidence. And Ayurveda is one of the oldest forms of lifestyle medicine that gives us very good knowledge. If I can ask you all to do something simple, would be just Google searching or YouTube searching. There are a couple of simple terms that you can search. What is Ayurvedic dosha, which is DOSHA, not dosa, DOSHA. Dosha means the inherent constitution of our body. We are all made of 5 elements, which is air, water, fire, earth, and space. And various elements combine in different proportions to make who we are. And so you will learn as to how certain activities or certain actions that you do actually affect your health based on these 5 elements. I'm not going to go into too much detail about Ayurveda today, but this will be a good book that you can read. Is called Everyday Ayurveda, which is written by an author called Vasudev Bhattacharya. And if you can take down notes, that'll be awesome. And then another good book would be What's Your Dosha, by Lisa Coffey, Coffey. That's a very good book. In fact, that book talks about how each one of us has a certain personality based on our constitution, body constitution and mind constitution. For example, some of us are type A personality, some of us are very chill, very careless. You see that there is difference of personalities, very carefree. Some of us are very particular. This is how things have to happen. Some of us are very flexible, and those are all actually driven by not just the gene, but actually the gene makes the tissues of our body based on the proportions of these 5 elements. So therefore, some of us are very thin, some of us are obese, some of us are big and tall, some of us are very petite. And so if you may have heard about these 3 words, Vata, Pitta and Kapha, if you can understand these things, this will not only help you in professional life if you happen to go into the medical field, but just as a wholesome human, it will be very helpful to understand the aspects of Ayurvedic terminologies. You will feel much more connected with everything. For example, you and your partner, say whether your sister, your brother, or your future husband or wife, you will actually be able to understand each other better because you know that is what you expect from their underlying body constitution. Similarly, if you are a doctor, going to be a doctor in the future, you will not only talk about giving them a pill, but actually go into the details of what kind of food they are eating, what kind of season are they getting into trouble with asthma, how is their exercise and regimen and so on. All of these things, you will have a much more broader perspective if you happen to know some of the basics of Ayurveda. Various practitioners are now doing something called integrative medicine, where they actually learn not just Ayurveda, but they learn so many different systems of medicine. Traditional Chinese medicine, they do acupuncture, they learn about naturopathy, they learn about homeopathy and so on. So yes, it is a good idea to learn some basics early in your life, and you will be a much wholesome person if you happen to know some basics of Ayurveda, especially if you are from India. It really will be, I will be proud that our Ayurvedic tradition is actually being carried by yourself, leave alone in America. A lot of Indians have come to America and spread the magic of Ayurveda, and now so many Ayurvedic practitioners are actually, even American Caucasians are practicing Ayurveda. There's an institution called NAMA, N-A-M-A, National Ayurvedic Medical Association, which is very much running in California, and you'll see so many Ayurvedic clinics in San Jose, Santa Clara area. So if you want an exposure to what Ayurveda means, I would totally go into one of these clinics and ask the doctor there, hey, I would love to get exposed to what you're doing. They do something called pulse examination. They understand so deep into your daily activities and so on. So I am very fortunate that I learned all of that, not just for the patient's health, but my own health, my wife's health, my family's health. I advise so many other of my patients here and there. uh, I try to translate Ayurveda into scientific Western terminology, and they are, many times my patients are like, wow, nobody has spent time like this trying to help me understand what I am doing in my daily life that's causing my disease, rather than just giving them a pill, say Pantacid, or take some protonics and take this forever and you will not get any more acidity. And unfortunately that's not how it works. The body has a ceiling effect, and within 30 days usually these medicines stop working, and your symptoms actually continue to worsen. So a pill is rarely an answer for many medical diseases, unless you have, say, something like an antibiotic necessity for a local infection or sepsis, from a pneumonia and so on. Yes, Western medicine is absolutely what we need. However, for preventative medicine and healthcare and all that, Ayurveda helps a lot. So I'm hoping you can spend some time on that.
Thank you so much. It's really interesting looking at a more holistic and balanced perspective alongside modern medicine, because I feel like not a lot of people really talk about that. We do have a couple more questions as well. Is it better to do the 7-year BSMD program or the traditional 8-year plan for undergrad and med school? And does shadowing under a doctor help in any way?
Shadowing under a doctor absolutely helps. In fact, some of you may have already done it yourself, and you all can probably put it in the chat group yourself to see, yes, absolutely, whether you recommend it or not. And that's where connections help a lot. So don't be shy to ask for, hey, who are you? What are you doing? Can I get to know a little bit more about your daily life? If you see some uncle or some auntie in any gathering, uh, right now, yes, it's important that you study a lot. You probably stay indoors a lot, spending time with the books. But it definitely helps to get out there, meet people, and create connections, so that they know you 3 years from now when you're looking for some internships or this thing. They know, oh, I met you at that party. Yes, come on over. Why don't you shadow me in one of my office visits? So yes, definitely, please do shadow. Um, and so the 7-year versus 8-year program, I don't have any experience, but I do have a friend who did that. And as I said, they are probably very tough to get into those kind of institutions. And number two, what are you trying to do? You're probably trying to save 1 year. Don't break your head on that. If you happen to know that, yes, absolutely, you want to go into medical school, there is no question about that, then yes, it is worth trying for that. So for that, you need to know people who have already gotten into those kind of programs. That way you know exactly what they are looking for, those institutions. And number two is, it's never too late to still change your plan. You can always get into these programs and still say, you know what, I don't want to go into medicine, and you can always go into biomed or biotech. So that's the good thing about US system, is that it's never too late to change plans. It just sometimes feels uh, feels like, man, I wish I knew exactly what I want to do. You don't have to exactly know what you want to do, as long as you enjoy the experience of that particular day, that month, that year. Create a small short-term plan and a long-term plan, um, because beyond all of this, there is somebody above who's controlling our life. You can set a plan towards a certain goal, saying, yes, let me try to get into the 7-year program. Let me see if it's doable. uh, is my energy going to sustain this much amount of effort, or do I want to take it easy, take it slower, and aim for the regular undergrad, and then figure out by year number 2 or 3 whether I really want to go into medicine or not. So that's what's going to help you decide whether you want the 7-year or 8-year program. And of course, specifics of these, I'm guessing there are probably not more than 10 to 15 programs in the country that are doing the combined programs. So start searching on the net and go into Reddit forums or student doctor forums. There are a lot of Facebook groups probably of these specific institutions where you have seniors from this program, and you can try to meet them and see, hey, how is it different, the prep and all and so on.
Thank you. Yes, fascinating. Shadowing a doctor is truly a fascinating experience. And I feel like we can learn a lot about what the medical assistant does as well along the way to see if we're interested in that. Or I remember I shadowed a nurse practitioner at a VA hospital, so that was a really different experience as well. So, shadowing a clinic, a hospital, or a VA hospital are all different experiences, and I think it's important to see all sides of medicine. We have a few more questions. What are educational pathways to become functional or integrative specialists? Do you need to go through the standard MD pathways to become one?
Mm. Uh, so yeah, so there are different levels of being a practitioner. Um, for example, there is something called a health coach, health counselor, and then an integrative medicine practitioner. So you don't have to have uh, a regular MD to get into certain aspects of integrative, counselor and all that. But if you want to be an actual physician, then yes, you will get through medical school, be an internist, and then on top of that, actually get accredited by the Academy of Integrative Medicine. One of the institutes is in Arizona, University of Arizona. They started one of these, Andrew Weil Center for Integrative Medicine, and beyond that, now there's a lot of institutes that train you. And similarly, functional medicine also, there is Institute of Functional Medicine that gives certification courses. It's very thorough, full-fledged certification courses. So yes, definitely you will go through your regular internal medicine or the medical school part of it.
Thank you. And we have another question. This is about something a lot of students have asked before as well, is the work-life balance, because
Mm,
being a doctor is really hard,
yeah,
and how do you balance your life alongside that?
sure. So what I would say is, see, I try to be a wholesome person. uh, I try to be not just a doctor. I try to first be Prashanth. There are so many things, so many roles that we take on every day, right? From this time to that time, we have, like, say, I'm a brother, I'm a father, I'm a husband, I know music, so I'm a musician. I am into gym and fitness, so I have to take care of my own body. So, which is very stressful to hear, but it all boils down to, you need to know when to say no to something. You cannot take on too many things at the same time. It is okay to say no to something so that you can say yes to something. Automatically, when you say yes to a person, it means you are saying no to somebody else. You cannot be in two places at one time. So, and you have to own that decision. For example, if I'm into music, so I like creating audios, videos, but that takes a lot of time. It takes time away from going to the gym. So that's where my wife actually tries to keep me in check, saying, hey, you've been spending a lot of time with your laptop trying to create, on GarageBand. I sing, and then there's not just singing, right? You have to edit those tracks, and to put it on Spotify, YouTube, and all that. Uh, so that's where your family also comes and helps you out, where you take a break, and at any point of time, it's best to do 20 to 30 minutes of something and then actually step back. Okay, it's been a while since I've been, I've stepped out, so let me go out, take a fresh breath of air. And anytime you see greenery, it's very relaxing to the brain. So because the green wavelength apparently is very relaxing. So those are things that you will have to keep, habits. You cannot become a doctor and then try to work on work-life balance. Work-life balance starts right now as an 8th grader or a 9th grader. And similarly, some people say, oh, I'm going to work really hard now, I'll take rest and I'll take all these sport activities or gym or yoga, etc., after I retire. And that time you're too old, your bones are probably going to be super weak. So then and there, every day you have to take care of your health, because you are not just a professional. You're just not a professional alone, right? You are more than just a professional. You are a person first. So personal life, for example, the thing that I do is I try to plan ahead of time, to give myself some vision of, okay, what I want to achieve in this next month. You create a plan, but that doesn't mean that it's going to happen that way. At least you have some sense of, okay, I want to run this activity over this period of time, and leave the rest to God. He will, because we are ultimately instruments of God. He is trying to achieve something through us, and we keep thinking that we are actually trying to achieve something. No, things happen in such a way that we accept this as the reality, that we are the doer. No, you are not the doer. He is the doer, and we happen to be instruments, but we keep thinking that we are actually planning this entire life out exactly the way that I want to be. And that's when stress happens. When you exactly want life to go the way that you want, then God shows the reality and saying, nope, that's not how things work. And so you get really stressed about, why is this not happening exactly the way I want. So you do your part, and then, as Bhagavad Gita says, don't expect exactly the fruit of your action at the exact time that you want, the exact way that you wanted it to be. It may or may not happen. If it happens, perfect. If not, just move on, learn from what you did, get feedback. And that's one of the most important things that I would say. Work-life balance is get feedback from the things that you do, or the people that you meet, so that you can improve the next time you do something different. So plan your day, create new habits, create one new habit every year. That way you are always exploring new things. But please take care of your health, and that's why I think Ayurveda or traditional Chinese medicine, all of these lifestyle medicines help a lot, so that you know how much time to spend on sport activities, or just a gentle walk outside in the neighborhood, and socializing with family. For example, in Ayurveda and yoga, there is something called the throat chakra, right? So when we don't spend time expressing our feelings with socializing, a lot of emotions get stuck in us. And so that's a very simple example of how socializing is very important, especially during the stressful years of studies. So if you lock yourself up in a room and just say, nope, I need to focus, that's very nice of you that you are being very disciplined and studying, but it doesn't mean that you don't come out here and there, socialize, go get a fresh breath of air, play some pickleball, or go for a yoga session, or whatever it takes. Be the person that you want to be at age 40 right now, right? You don't wait till age 30 or 40. Once you get a good job, you want to settle down with a lot of money, and then you will be like, okay, now it's time for me to play pickleball or go to the gym and lift some weights. No, today is the day. Start small, even if it takes 10 minutes of 10 push-ups here and there. Especially for women, it's very important to do resistance training and all that. So please get into any form of activity. It doesn't have to be a sport. And then please learn something called transcendental meditation, which is the simplest form of meditation. It's slightly costly to actually get a lesson on transcendental medicine, but it's totally worth it. It's actually cheaper for students. Just look up a TM center near me, or when you go to India, it's much cheaper. You can always get trained there. A simple, beautiful form of meditation, just literally sitting, closing eyes in the morning, 10 minutes. it boosts your memory, and your entire immune system is so amazing that you will function much better during the entire rest of the day if you did 10 minutes of meditation. Whereas if you don't do that 10 minutes of meditation, the entire day is kind of not so great. So you're preparing your brain and your entire body for an amazing day. So these are all things that luckily I got exposed to, thanks to my family, and thanks to God for putting me in, exposure to all of these things. So that's what I would call as trying to achieve work-life balance is knowing when to say no, and then trying to create habits, not when you are a doctor, but actually when you are a student.
Thank you. I really like the throat chakra example because I haven't really thought of it that way, and that was a new term. We do have a few more questions too. Is the process getting to for less rigorous areas of medicines like dermatology or medical research as a practitioner different from getting to more rigorous areas?
Repeat that question.
Is the process of going for less rigorous areas of medicine like dermatology or medical research as a practitioner different from getting into more rigorous areas?
Okay. So, for example, let me tell you one thing. You can have a very stressful day even if you are a dermatologist, if you have a very busy practice. So that's where you need to learn when to say no. For example, seeing 20 to 25 to 30 patients is definitely going to be more rigorous than seeing 15 to 20 patients. So that's number one. Number two, in general, yes, dermatology, these are all outpatient jobs. So people don't die from not seeing you in the clinic. If they have a dermatology problem that's going to kill them, they'll be in the ER. For example, there are diseases like allergic anaphylaxis, or drug allergy side effects, or Stevens-Johnson syndrome. Those are all some of the skin diseases that can worsen like very quickly, and then boom, you can die from them. And those guys are not coming to see you in the office. So yes, dermatology, rheumatology, these are all outpatient jobs. So dermatology will be a residency, which is done after medical school. It's very hard to get into apparently because it's a lifestyle specialty. Because people think that when you go into dermatology, it's good money and it's a good lifestyle because it's 8 to 4 kind of jobs. However, there are I agree with the fact that neurosurgery or cardiothoracic surgery, plastic surgery, plastic surgery can be done after general surgery, as against after dermatology. You cannot become a plastic surgeon, whereas you can do some cosmetics after dermatology, but for that you need to go into fellowship after dermatology residency. Yes, all these surgical specialties take more time because you have to finish general surgery, and it's hard to get into general surgery. And then after general surgery of 3 to 4 years, you have to do fellowship, which again takes 2 to 3 years. Night shifts can be very traumatic to the body, and that's where certain people who really love certain things, they compromise. For example, if one of you, if you are so into surgery, I love surgery, and if you want to become a surgeon and you say, no, I love being a cardiothoracic surgeon, I don't care the fact that I'm working in the middle of the night trying to open somebody's chest and saving their life. If that's what your soul is telling you, that no, I want to be this, then follow that. At the same time, even with that job, you can achieve the work-life balance to the extent possible by taking good care of yourself. So that's where you need to know the support systems, what kind of support systems you can have, reaching out to your own colleagues if you're having too much of a stressful week, when to say, you know what, I'm going to take a couple days off, or you can say there are jobs where you can do only elective surgeries, and you don't want to be on call for any emergency surgeries. And hospitals are actually moving that way, where they have an in-house surgeon who will do week on week off, and he will come only for emergency things, whereas there is a separate set of surgeons who do only elective surgeries. For example, cancer surgery is elective surgery, like somebody who's going to get a cancer removed. They don't come in as an emergency, whereas there are sometimes emergency, say somebody had, for the first time they come in with severe abdominal pain and they find that they have actually cancer. So that's an emergency surgery because they can rupture. So you can, the good thing is the future is moving towards creating these options for surgeons also to choose lifestyle friendly jobs, and hopefully you know how to choose the exact job profile. That's why when you become a doctor and when you interview for various jobs, you need to know exactly what kind of profile of the job I can take. For example, I decided I want to take Fridays as admin day. Admin day is basically where I I just tell them I can't see any more patients because I have so much of backlog of things that I need to do about the patients that I've already seen yesterday. So I tell them I just need half a day time where I can just finish all these paperwork and all that. And so those are things that you can always negotiate when you look for jobs and all that. And this is not just in medical field. It's sad that even in industries like computer science or engineering, because ultimately customer is king, right? So if the customer or your client, the boss of the client, if he's unhappy, that's the same as my patient being unhappy or my patient dying. So therefore you get, even if you go into engineering field or if you are in the tech field, the client says, guys, I need this done with a particular deadline. That is a very stressful job. That is no different from a neurosurgeon. Because you see that there is no discipline of timeliness anymore in both India and America, that people work all day, all night. There is no boundaries, and that's where you get to decide what is a stressful job. I don't think the job by itself dictates whether it's a stressful job or not. So you have to create discipline where you put a boundary. Okay, from this time to this time I am a professional. After that I am Prashanth. After that I am somebody who loves going to walk. I need to, and after some time I say I just take a 10-minute Sandhya Vandanam, or go and pray, or go for a music class. In fact, I would tell now, I've been always recommending this. Even in my 9th grade, 10th grade exam days, 11th and 12th, I used to go to party class, music class, because for me that was like an escape from my room. I used to study continuous hours, and I wish I did not put in those back-to-back hours, and I used cricket and music class as a great escape. Whereas for some other people it may be like, no, I don't want to go to music class, that's not going to help me now. But no, it helped me so much because it gave me a rest for my eyes. That way I don't have to keep looking at books continuously. It helped me just breathe easier, and go out, get into the fresh air, go meet people, and so on. So continue to do all your co-curricular activities, because you are more than just a student, right? You're not just a student, you're more than that.
Thank you so much. Before we wrap up, we just have one last question. What are some things you would do differently if you got to start over?
Nice. Wow. So I love the fact that I got exposed to the Indian medical school system. I always keep wondering, what if I was already in the US as a medical student? I did not do medical school in the US. Would I have felt, different, better? Probably yes. But that's where the beauty of the Indian medical system is also there. You get certain aspects of the Indian medical schools that you don't get here. The different social conditions which are also available here. You get to see poverty patients, you get well-off patients, But the Indian medical school system um, deals with more of skill sets that you learn without the help of too many tools like radiology, imaging, and etc. You listen to a lot of the auscultation sounds, you percuss on the chest. Those are things that I'm very thankful. Like even now, I don't see many other doctors actually percussing on the belly to hear whether it's tympanic, whether they have ileus or not. Ileus is basically gas building up in the stomach. So those are things that I'm always proud of. So it's never a complete win-win situation. There is always, retrospectively, I wonder if I would have been a better doctor if I studied in the US. I probably would have been even better, but I'm thankful that I got in medical school experience in India. But I'm so thankful that I got exposure to residency in the US and fellowship. I did it in a community hospital. I did not do it in a main university campus. Would I have been even more strong? I would probably have been more into research and all that if I did in a university campus. Um, University campus hospitals are also pretty busy. Um, However, I noticed that community hospitals focus much more on clinical experience than basic science research and all that, because community hospitals, they don't do much research. They are focused purely on seeing patients, getting them fixed, and so you will become, because the turnover and the number of patients and all that is much more rapid, you will become very clinically strong if you are in a community based hospital. So um, so I appreciate that. Yes, I did my residency in actually a community setting rather than a university hospital setting. Those aspects I appreciate, but again I wonder if I would have had a little bit more research background, because now I feel like, damn, the future is going into bioinformatics and all that. So I wish I was into AI, just like anybody is talking about. And I wonder, those are things that I still feel like I want to be prepared for the future, because nowadays I'm very concerned that doctors, the number of doctors that will be needed into the future possibly maybe lesser compared to now. You never know. People are probably going to become more and more sick in more numbers as we go into the future, unfortunately. Unless you all, as the future of America, can create more lifestyle awareness and so on. But definitely, I would have loved to be involved in some amount of computer science along with my medicine. So that's where undergrad really comes to help, because I would have at least gotten some amount of coding skills or some bioinformatics skills if I had done undergrad, where I would have had some electives in some coding data, or even prompt engineering and so on. So now I'm trying hard to figure out to be one with the group, because some of my doctor colleagues, they are actually from America. They are locals, Caucasians, and they had some background in computer science and tech industry. And one of my other colleagues who's from Canada, he is now the CEO of a health tech company after having done residency along with me. So people are going into various pathways. So I just wish I had a broader experience, but it's never too late. That's why I'm trying to somehow prepare myself for the future, not just by being a regular pulmonary critical care doctor. I still am very happy that I'm doing something that others cannot do. Like, I save lives. I put in needles into very, very intricate parts of the body where I'm literally 1 to 2 millimeters away from poking the heart. And I'm very, very thankful that I'm doing all those things. But I always wonder if I can catch up with how this AI movement is going on. But it's okay. Just being good at what you do is good, but it's okay to innovate and keep adding skill sets to your forte. For example, even as a pulmonologist, we just learned robotic bronchoscopy just 3 years back, and this robotic bronchoscopy was not there 10 years back. So the good thing is hospital companies, they themselves get you exposed to all these new technology that's coming, and you just have to have the inner fire to always add more skill sets to you. Otherwise, you will be replaced by somebody else who has those skills.
Thank you so much. Thank you again, Dr. Muthukrishnan, and I want to thank you for taking the time to speak with us today and share your experiences and advice. I think we all know that one of the biggest takeaways from today is that career paths, especially in medicine, as we're talking about, are not just about reaching an end goal because, as you mentioned, they're about learning, adapting, asking questions, gaining experience, and really figuring out what aligns with who you are. To everyone who joined us today, thank you so much for being here and for spending part of your weekend with us. We really appreciate your curiosity and engagement. We'll also be sharing a webinar recap, resources, and the recording afterwards, so stay tuned for that. Thank you again, everyone, and have a wonderful rest of your day.
Thank you.